This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Today's weekly COVID update podcast is being recorded at 8:30 in the a.m. on Friday, May 8th. TGIF, it's Friday, May 8th, and as of today, Linn County has had 805 cases and 56 deaths. We've moved in this week following the governor's proclamation to restart surgical operations, and we're still in phase 1. And that is going to be phased in over the weeks coming to restore, hopefully by the end of June, full operations. Critical care capacity as well as supplies, and including blood supply, both are in the green, and we continue to be more resourceful and getting smarter all the time on how to deal with potential surges or other concerns that may present. I'm probably more optimistic and confident. And confidence usually isn't a lack of confidence isn't something I usually have a problem with, but I'm really confident that we're prepared for anything that should present. But I do want to cover one topic today because it's starting, and that's the allergy season. And questions arise that how do I tell whether or not I have allergies versus a COVID-19 affliction? And it's an excellent question because there is some overlap. The first question that I ask people is, well, have you had allergies before? And if you have allergies every spring and fall and it's related to the pollen counts, or for me, it's when they first turn on the air conditioner in the building or first turn on the heater in the fall, I tend to get some sinus congestion. If you've had them before and it's consistent with that, then you're probably not experiencing a COVID-19 affliction. COVID-19 has, not to go into detail, the virus is structured in a way that it tends not to afflict the upper respiratory tract from a standpoint of the sinuses and the mucosal membranes of the upper respiratory tract. It tends to afflict the posterior or the lower respiratory tract. So sinus congestion and runny nose are not something that's typically seen with COVID-19 infections as it is with allergies. However, COVID-19 does have an interesting is that patients can lose the sense of taste and smell. And that's been reported enough that it's significant and does appear to be consistent with that. And so that does overlap with allergies on some degree. Certainly you can lose your smell, your taste may be altered if you have allergies. If you have systemic or symptoms other than your respiratory tract, upper respiratory tract that you would experience with allergies, shortness of breath, cough, fever, very unlikely allergies causes a fever. And if those things are present, then certainly it's time to be evaluated for the possibility that you may have COVID-19. Now, the other concern is that with the production of rhinorrhea or a runny nose, that would be particles of COVID-19 present in that. And then so now you have a vehicle to move those droplets from person to person. So masking is even more important than it was from the beginning as the allergy season starts. I think the bottom line recommendation or suggestion is that if you're concerned that you're with symptoms and it may possibly be a COVID affliction, then it's time to be evaluated by a clinician and make a determination for testing. But as always, practicing the 3 C's, whether it's allergy season and COVID-19 or just a good practice, is to cover your cough and your sneeze, clean your hands and surfaces frequently, and also contain yourself if you're ill. As I've said before, with clear heads and quick hands, and as we added last week, clean hands, we'll be able to deal with this pandemic because we know what we do, we know how we do it, and it's times like this we learn the why, and that's important. For the most up-to-date information on COVID-19, visit our website at unitypoint.org or the Centers for Disease Control and Prevention website at cdc.gov. Be well and stay safe. If you have a topic you'd like to suggest for the COVID-19 pandemic, please shoot us an email at stlukescr@unitypoint.org. In the meantime, wash your hands, cover your cough, and confine yourself if you're ill, and practice social distancing.